Welcome back to Angel Vinny Innocent tutorial. In this video, we are going to study about the principles of children policy in India. So, here we are going to study the principles. So what are the principles of children policy in India? So that we are going to study here. The first one is a health program for all children, including the nutrition services for children. So here, first is the health program for all the children. So there is no exception for those things. So health program for all children, including the nutrition service for children. So that is the first principle. And second principle is the of children provision of healthcare and nutrition education for expectant and nursing mothers. So what is a prohibition of healthcare? Prohibition of healthcare means to maintain the healthcare, to prohibit and to improve the healthcare and the nutrition education for the expectant and nursing mother. So what is a nursing mother? As I said, what is a nursing mother means a feeding mother. Okay, so feeding mother we can call the nursing mother. Then here those who all are expectant. So we can say that expectant means the children, those are in the adolescents. Okay, adolescents, so we can say that. So that is the second principles. And third one is free and compulsory education up to the age of 14. So they should get the free and compulsory education up to the age of 14. That should be informal education for preschooler and efforts to reduce the wastage and stagnation in the school. So I hope you guys heard about that also in the slum area, village side. So there, children they are not getting the sufficient education for them. So they have to provide the free and compulsory education up to the age the 14. That is very important. Then fourth principle is out of school education for those who's not having access to formal education. So out of school education. So those the children it's not getting the this one education. We have to provide for the formal education. And then formal education means in the village area they will set up the education. This one they somebody will come and take maybe especially that Anganwadi or the play school teacher they will come and take the formal education to the adolescent girls. So that is the fourth one. And fifth principle is the promotion of game, recreation, and extracurricular activities in schools and community area. Yeah. So promotion of game. So if there are any no recreational programs like games or whatever it is, not is there means what will be happen? So the students won't be have the interest. Student won't be have the interest. Then what will be happen? So they won't come. So that they will provide the recreational this one games and recreation and extracurricular activities in the school and that will be help to attract the children to come and study. The next one is the special programs for children of weaker sections. Some students they are very weak in some subject, so that subject or that weaker children they will provide the special sections for the weaker children. So that is a special program for the children of weaker sections. So next one is the and seventh principle facilities for education, training and rehabilitation for children in distress. So facilitate for education, training and rehabilitation for children in distress. So what is the meaning that so the children who is from the broken family children. So for this, they having any stress or depression, distress or depression for those children. So they will provide the what are the thing education and the training rehabilitation. What is the meaning of rehabilitation? To restore their health, to restore their health, so that they will provide all those things. Then they will facilitate for the education, training, and rehabilitation for children in distress. Those who are in very depressed family or a broken family, they're depressed and they are distressed, all those things. Then eighth principle, protection against neglect and cruelty and exploitation. So some are they are suffering very negligence. So they will maybe family negligence or the friends they will neglect the others. So very cruelty and exploitation. So for those children they will provide the protection. And ninth one is banning of employment in hazardous occupations and heavy work for children. So they banned the children in working there in heavy work. Like mining, have you heard about the mining sections? Some of the gold mining, so like petrol, whatever it is. So the mining sections in very heavy, this one hot and cold some place. So their working children is very hazardous. Then they banned. And tenth principle is special treatment and education, rehabilitation and care of physically handicapped and emotionally disturbed or mentally retarded children. So here they're given the special care for the special retarded children. Special care for special retarded children. It's like a mentally retarded children, they will give that special treatment, education, rehabilitation for the physically handicapped or emotionally disturbed, mentally retarded children. Then 11th principle is the priority for protection and relief of children in times of nationally distress or calamity. So those who are affecting or they affect the distress or calamity, or maybe like any floods. Okay, calamity we can say is if there are any floods or volcanic eruption. So those all the things. Maybe is there anything like is there any tsunami? So all those things, so they will give the priority and protection for the children first. Then 12th principle and a special program for talented and gifted children, particularly for the weaker children. So weaker children will be there. Weaker children, we can say the Down syndrome children. Down syndrome. So that they are very talented. For them, they will give the more special program. But they are talented people and they have the Down syndrome, so they will provide the more special program. And next, 13th principle is the paramount consideration in all relevant laws is the interest of children. So this consideration, these programs, all is based on the interest of the student or the interest of the children. The children is don't like. So doesn't like means it we shouldn't force them. So that is the thing. And the last principles of children policy in India, strengthening the family size to enable the children to grow within family and neighborhood and community development. So strengthen the family size. How we can strengthen the family size to enable the children to grow. To why we are strengthen the family size to help and to grow the children in their family, their society, community, all those development. So these all are the principles of children policy in India. So when you are writing the exam, how you have to write? So you have to mention all these 14 principles in the pediatric exam. Then one by one you have to give the explanation. If it is asked for the this one long essay, 10 marks, or the 5 mark short essay, you have to mention all this and you have to write it more about each principle. So This is the principles of children policy in India. I hope you student understand. If you have any doubt, you can comment below the description box. So if you want something, any extra, this one syllabus or the extra topic I want to take means you can suggest. You can suggest below the comment box. I will take the class for you. So thank you for listening. Thank you all.